medical student interviews is we just want them to be a resource for other students who are interested in medical school, and just like kind of getting that insight that we can share within our network to just let them know what the deal is when it comes to medical school, you know?
For sure, for sure.
My name is Omar. Franklin and Marshall. I'm a rising sophomore. Would you like to introduce yourself?
So I'm Cameron Rutledge. I'm going into my second year of medical school here at Lewis Katz School of Medicine, Temple University, and graduated from Franklin and Marshall 2016. So one of the old heads, I guess.
Can you just briefly describe your route to medical school as a minority student?
Finished at F&M 2016. I was a chemistry major. Went to Cape Town for a year, did a fellowship through the CTC 10 Foundation, lived and worked there for a year. Soon after, went to Geisinger Commonwealth School of Medicine, where I got my master's in biomedical science. Went back to Miami for a year, worked as a medical scribe, specifically in urology, but also dabbled in orthopedics, dermatology, and a few other specialties. And in that last gap year, applied for med school and got into a few places, but Temple had won me over, so I'm now attending here.
If you don't mind me asking, like, what was it that won you over for Temple? What was that determining factor?
So a big thing for me was when I was thinking about the schools I wanted to go to, commitment to the community. So Temple, like, talk the talk, but definitely walk the walk as well. And as I was going through the interview process, the day I was going to that specific school, I would always ask, like, whichever Uber driver, Lyft driver I was in the car with, about the institution I was headed to, what they thought about it. And that person, being from the community, was gonna keep it real with me. So telling me, like, hey, like, Temple's really about it. They're trying to help us out here. And I was like, all right, well, you got me sold. But then throughout the course of the day, the interview, seeing other students of color, learning that, like, this environment is one in which we can thrive, like, I was sold.
So what life experiences have impacted your journey or your motivation?
So my mother's an insulin-dependent diabetic. So I grew up seeing her and what she was dealing with and living with that condition. But also just had a network of people who pushed me to, like, do the best I can in whatever field I so chose. But from an early age, I was saying, like, oh, I want to be a pediatrician. I want to be a pediatrician. And have also had people tell me, like, or teach me that we all have a moral obligation to help one another. And that can be done in whichever field anyone so chooses. So if someone goes into teaching, like, you're molding the minds of the future generation. Being a doctor, you're going into, like, helping heal people. Medicine was the route I chose because it allowed me to incorporate science, service, and, like, a love for people, making sure, like, we're healing one another.
So what's one word you would use to just describe your journey to where you are today?
Long. So for some people, like, they go straight from undergrad into medical school. So, like, that, I don't want to say immediate gratification, because of course, like, they work hard, as is everyone who gets into med school, but definitely had a longer journey with 3 gap years from undergrad to med school. But it taught me persistence, it taught me patience, it taught me resilience. And, like, if you have a dream, like, you go for it. You find the right people who are going to be there along your path, whether that be physicians involved in patients are waiting, shout out Dr. Cherise, whether that be other mentors along the way. But people are going to invest in you when they see you're invested in your dream. Definitely a long journey. Definitely a lot of life lessons learned along the way.
I mean, it sounds like you've had some incredible experiences though out of that journey, so that's pretty cool.
Hey, I'm blessed. I'm blessed.
So, like, you kind of touched on it a little bit, but, like, just going into, like, the application process. So I know, you said it took you a little more time. What was the most valuable thing you got out of the application process?
Just learning to work within, like, a system. I wasn't familiar with that application process by any means. I didn't have any people in my family who were physicians or who had applied for med school. So like learning from students who were either who graduated my year from F&M or years before me, learning from them, whether it be Marvin Nicola or Indy Egpa, like students from F&M, they're always willing to like give the baton or pass the baton on. So I learned from them. But again, like that persistence, that resilience, that patience, because the application process can be a nerve-wracking one. It can be a grueling one, whether that be primaries, your secondaries, and then even like waiting to hear back from schools for interviews. Um, Definitely builds up nerves along the way. So being able to like reflect, like, hey, I've done the best I can. I made sure I was the best applicant I can be when I sent in my application, and knowing that like the rest is up to admissions officers.
So is there anything like maybe like a tip that you would give, like maybe like whether when it comes to like materials or like crafting your resume and your experience, what's one like concrete tip you would give to somebody applying to medical school?
Make sure you're as reflective and like open and honest with yourself as you can be. Um, Make sure when you do apply for medical school, you are the best applicant you can be. So if you're looking at your GPA, whether that be science or overall, and you're saying like, all right, I don't know if I'm here yet, like that's perfectly fine. Like be honest with you and say, well, maybe I need to do this post-bac. Maybe I need to do a master's program. Maybe I need to take classes on the side to boost my GPA. There's absolutely nothing wrong with that. If you're taking the MCAT and you're not satisfied with your score, like feel free to take the MCAT again. Like I was one of those students. I had to take the MCAT more than once. Absolutely nothing wrong with it. And schools see like, hey, you tried, like you put in the effort. You wanted to, excuse me, you wanted to make sure when you applied to our school, you were putting your best foot forward, and we appreciate that. So being honest and reflective with yourself, and also like ask for help along the way. Like some of us are already here. Like hit us up and be like, hey, like, can you look over my application? Can you look over my personal statement? So on and so forth. Like we're willing to do it because like we didn't get here alone either. So we're part of your village now.